Mr. Governor, the Incident Commander of the Lagos State COVID-19 response, members of the executive here present, led by the Secretary to State Government, Mrs. Jaji, and the Commissioner of Information, Mr. Omotosho, the Executive Director of the National Primary Healthcare Development Agency, Dr. Faisal Shoaib. You're welcome. Thank you for coming to Lagos for this very important occasion and twinning this conference with a very significant event which we're going to hear about shortly. Members of the body of permanent secretaries of the Ministry of Health, let me stop at this point and just say welcome to everybody else in the interest of time. Mr. Governor has a very tight schedule today, so we're very privileged to have him join us on this very important opening ceremony of the 7th African Biosecurity Conference and One Health. So my slides are up, and basically I've been asked to talk about, this prompter is not working, please. I've been asked to talk about what we're going to hear about for the next 3 days, and essentially we're going to be talking about the age of biological shocks, and it has been predicted as far back as 2017 that the world was going to experience a global biological threat of the magnitude that would destabilize most countries and cause economic hardship, insecurity across the globe. Indeed, from 2017, it only took 2 years for that prediction to come about. Certainly, we understand what the factors are that are driving these kinds of predictions. So what are the threats? The threats are essentially in 4 parts. Climate change, as you've heard, is a major factor. Environmental destruction, and the massive interconnectivity between countries. And on a scientific note, our ability to manipulate genetic material and genetic life forms. So climate change is a major issue. We all know that. In another few weeks from now, we'll be experiencing the COP26, which is the Conference of Climate Change. We know that deforestation and environmental degradation is causing massive rural migration to urban locations, and that's causing a continent described as a continent of megacities, and Lagos State, or Lagos, is an example of that. What is driving the emergence of infectious diseases in Africa? And you can see from this map that Africa is hot, which means that we are experiencing a large number of infectious diseases on an increasing basis. So some of the common pathogens that we describe are pathogens of high consequence, and a list is there for those of you that are medically inclined. You will recognize these pathogens. There are quite a number of them, and one of the speakers that is going to follow me will describe some of the techniques that we're using to find where these pathogens are and how they are mutating. And this indeed is one of the biggest threats that we experience. The ease and ability of people to move very quickly from one location to another, and people carry infectious diseases, and through this methodology, agents of concern are spread very quickly. So we're moving into the age of genomic intelligence. Everything we do now goes down to the genetic level, and this is a good thing, but it's also a bad thing if we don't know how to harness it. So in this slide, you can see we're able to detect the multiple mutations that are emerging from COVID. This is done in a genetic lab, and happy to say that Mr. Governor has given us the resources to acquire this very expensive and very technically advanced skill in Lagos State to carry out genomic sequencing. So what is indeed worrying us is the plethora of skills that scientists are now acquiring to tinker with biological forms, bacteria, viruses, and agents that what we call gain-of-function research, of concern. So if you're able to change a virus and make it more lethal for research, if we're not careful, these pathogens could escape. So these pathogens will be changed in a laboratory for research reasons to develop vaccines that are more effective, and if these pathogens are not kept in a very high security facility, such as a BSL-3 or a BSL-4, we may have an accidental discharge into the environment. So these are some of the issues we'll be talking about. Infrastructure is very important. For the past 5 years, we've been building infrastructure in Lagos. As you can see from this pyramid, there are 4 levels of biosafety categories, 1, 2, 3, and 4. In the last 2 years, we've acquired a 2 and 3 level. We don't yet have a 4. And if you look at the continent of Africa, you can see that there is a severe shortage of these biosafety laboratories. Only in Senegal, Ghana, Nigeria, Kenya, and South Africa do we have BSL-3 levels, and there's only one functional BSL-4 in South Africa. If you're going to be handling dangerous pathogens, you do need these biosafety laboratories to be able to diagnose them, manipulate them, and conduct research. What is the role of government? So there are several articles, international treaties that govern biosecurity. The Biological Weapons Convention, the United Nations Security Council Resolution 1540, the packages of the Global Health Security Agenda, International Health Regulations, and the One Health Agenda. We'll be addressing many of these treaties during the course of this conference. But suffice to say, the responsibility of government, basically, is to equip every country and every state with the ability to quickly detect, to bring to a quick halt a potential outbreak, and to do this, it requires to develop infrastructure, human resources, such that we can restore calm and avoid economic collapse as a result of these pandemics. There is a great need for nations to develop a biosecurity framework, and we're doing that at the moment across the West African region. We've already developed one in Lagos, and we're looking to work with the federal government to develop a national biosecurity framework. How do we prepare for these pandemics? This quotation is quite apt. Everything we say and do before a pandemic will seem alarmist. Indeed, we know that. In retrospect, everything we did will seem inadequate. This is the nature of pandemics. They come in waves. And we all know we've already experienced 3 waves in Lagos and Nigeria. But what do you do between waves? It is important that, in fact, between outbreaks, that you spend time building capacity and preparing for the subsequent outbreak. And what we've done in Lagos between Ebola and COVID was to build significant capacity, both in terms of infrastructure, human resources, and governance. If you're able to do these things, then you will indeed be able to achieve what we call flatten the wave. And you can see those yellow dots there are indeed activities that have helped us in Lagos to flatten our wave. And this is an example what flattening of the wave looks like. The orange graph is the surge of sick people that would have happened if you didn't have interventions. But if you have interventions, you can flatten that wave such that the number of people that get sick falls within your capacity to manage these surge of sick people. This is the profile of the outbreak in Lagos and Nigeria. First wave, second wave, third wave. And indeed, studying the way the waves emerge in Lagos, we know that the period of Christmas and New Year may indeed be an occasion that will usher in a 4th wave in Lagos. So we're preparing in this moment of peace that we have at the end of our 3rd wave to put things in place to ensure that if we indeed experience a 4th wave, that we can flatten it as much as we can and reduce its impact on civil society in Lagos. What is the World Health Organization saying? The World Health Organization is saying that every country should practice what's called the One Health paradigm, which means that human health is seen in the context of environmental health and agriculture. So we're trying to work together with our sister agencies in Lagos State and the federal government to ensure that we have and can demonstrate the principles of the One Health paradigm. In the themes agenda of Lagos, which is Mr. Governor's master plan for governing Lagos State, the second pillar there is characterized by health and environment. And it's almost as if in his vision, as he was developing the manifesto for this governance, he knew and understood and recognized the relationship between health and environment. In the future, we're developing what's called the Infectious Disease Research Institute in Lagos, as well as a permanent 300-bed isolation facility. This is to continue to increase our resilience and decrease our vulnerability to infectious diseases, and to be able to build the capacity to do research so that we can work with the rest of the world to anticipate such events and to bring them to a halt very quickly. I'd like, on behalf of the medical fraternity in Lagos State and the entire country of Nigeria, I want to say a big thank you to the incident commander, Mr. Governor, and his deputy governor for their diligent leadership in a time of severe crisis. This picture was taken on the day that we launched the Lagos State Incident Command structure. And I think you can see from the expressions on the faces of these two great leaders that they could almost see into the future and predict what was going to happen. And indeed, we'd like to give them a big round of applause. If it wasn't for their commitment, I think that Lagos would be experiencing a different scenario right now. Thank you very much for your attention.